Welcome back to the MedLink Health Connections podcast. Today's episode is a special one because we're celebrating a major milestone, 50 years of MedLink Georgia. Half a century of service is no small achievement, and to help us reflect on where we've been, where we're going, and what this anniversary truly means, we're joined by someone who has lived a big part of MedLink's story, our CEO, Dave Ward. With nearly 15 years of experience in the organization, he's seen MedLink grow from a small community health center into a network that reaches thousands across Georgia, while staying rooted in the mission that started it all. In this episode, we'll look back on the early days, explore the key moments and innovations that shaped our growth, and celebrate the programs and people have made a lasting impact over the decades. And of course, we'll talk about the future, what the next 50 years might hold, and the message we want to share with MedLink's staff, patients, and supporters as we mark this incredible milestone. Let's dive into the history of MedLink's past, present, and future. So as MedLink celebrates its 50th anniversary, what does this milestone mean to you personally?
Well, thank you for having me today. So, this milestone is very meaningful to me. It represents not just the longevity of our organization, but the enduring commitment of countless individuals, staff, patients, and community partners who have shaped MedLink's journey. Personally, it's a moment of pride and gratitude and a reminder of the responsibility we carry to honor our legacy while continuing to provide quality health care to countless Georgians for the future.
Okay, and you've been with MedLink for about 15 years. What first drew you to the organization?
Well, for me, it was first drew me to MedLink was its unwavering mission to serve the community. I was inspired by the organization's grassroots beginnings and its focus on providing accessible, compassionate health care to those who need it the most. The sense of its purpose and the opportunity to make a tangible difference in people's lives were powerful motivators in my decision.
When you think back to your early days at MedLink, what stands out the most compared to where we are today?
Well, in our early days, MedLink, of course, was much smaller and resources were very limited. What stands out is the resilience and the creativity of all of MedLink's team members, how we found ways to meet the community needs despite those challenges. And then today, while we've grown a lot in size and capabilities and resources and services, that same spirit of dedication and adaptability remains at the heart of our work.
MedLink started as a small community health center and has grown tremendously over the years. What do you think has been the key to that success?
Well, a couple things. I think the key to MedLink's success has been our steadfast commitment to our vision and mission of partnering with patients and communities to support the wellness through their compassionate quality healthcare and our willingness to evolve as healthcare changes. We've listened to our communities and the needs and adapted to the ever-changing healthcare needs and invested in our people and our resources. Collaboration and innovation and focus on quality care has been the key to our growth.
Okay. And how has MedLink stayed true to its mission while continuing to grow and adapt over the decades?
That's a great question. So MedLink has stayed true to our mission by keeping the needs of our patients and community at the center of every decision that we make. As a patient-centered medical home, that is exactly what we do. The patient is at the center. And so in doing that, even as we've expanded services and embraced new technologies and core values, equity, excellence, integrity, respect, service, and stewardship also has helped guide us on this journey. And then further, by the organization regularly revisiting our mission, ensuring that we never lose sight of why we exist today.
What are some of the most significant changes or innovations you've witnessed during your time here?
Wow, that's tough to capture in this short clip here today. But, some of the most significant changes included the integration of advanced technology in patient care, the expansion of our service lines, the development of our partnerships that we've made that have helped extend our reach to our patients in Northeast Georgia and even across state lines. Further innovations in telehealth, electronic health record systems, and our community outreach really has transformed how we deliver care today.
MedLink's roots are deeply connected to serving the community. What are you most proud of when you think about MedLink's impact over the last 50 years?
For me, what makes me sleep good at night is I am most proud of the countless lives that we've touched and the trust that we built with our communities and our patients that we serve. Whether it's improving health outcomes, supporting families, responding to crises, MedLink's always been a reliable partner in our communities. Our impact's measured not just in the numbers, but all the stories of hope and resilience in our patients' lives.
Are there any particular programs or initiatives that you feel have made a lasting difference in the communities we serve?
Yeah, there are several programs and initiatives come to mind, but I'd like to touch on a couple of them today. About 15 years ago, MedLink added 340B pharmacy services to help make medication affordable to everyone. Has been a key program. Previously to MedLink adding 340B pharmacies, many of our patients struggled with being able to afford their medication or having to make choices of either foregoing their medication and providing food on the table, paying their rent, utility payments, etc. Where now today, no patient should go without their medication with the 340B program. It's accessible to everybody. Further, our integrated behavioral health services have been key to help address the mental health of our communities. In addition to our outreach programs for underserved population and preventative health campaigns and partnerships with local organizations have made a huge difference. These efforts have helped MedLink fulfill our mission and address critical gaps in care and empower individuals to take charge of their health.
As we celebrate 50 years, it's also exciting to think about the future. What do you envision for the next 50?
Looking ahead, I envision MedLink to obviously continue to lead in the community-based healthcare that we have built on here, but continue to embrace innovation and expand our breadth of services throughout the organization and our reach to more communities and even in more states in the southeastern U.S. I hope we remain agile, responsive, deeply connected to those that we serve, always striving to set new standards in quality and compassionate healthcare.
And lastly, what message would you like to share with MedLink's staff, patients, and supporters as we celebrate this huge milestone?
To our staff, patients, and supporters, I want to thank them for being the heart of MedLink. This milestone belongs to all of us. Your dedication, trust, partnership have made our journey possible, and together we will continue to build a healthier, stronger future for our communities we serve.
Okay, well, thank you so much for doing this, and I look forward to the future. Thank you for tuning in to the MedLink Health Connections podcast. We hope you found today's episode informative and inspiring. If you enjoyed the show, please subscribe, rate, and leave a review on your favorite podcast platform. Remember, the information shared in this podcast is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider for any medical concerns. Stay connected with us on social media and visit our website at medlinkga.org for more resources and updates. Until next time, stay healthy and take care.